His psychiatric assessment was conducted by the University Hospital and the University Medical Association in London. He was deemed to be incompetent to proceed. He was detained on civil matters. A court-ordered treatment program was ordered. A court-ordered treatment program was mandated. The patient was psychotic and was displaying signs of drug-induced mania. This patient was physically defiant, behaving violently. Luckily, he was not in possession of any weapons. A drug test, urinalysis, was performed and it showed that the patient was under the influence of a drug known as crystal methamphetamine. The patient was detained and incarcerated in a maximum security psychiatric hospital. The patient refused medication and was taken to medication court in Chicago. The court decided that he was mentally ill and the judge ordered forced medication. Forced medication means the staff will medicate the patient regardless of his consent or lack of consent. The doctor ordered injections of Haldol once a month in conjunction with Jayodon, lithium, and Depakote. The patient resisted the medication, so a code violet was called, and reinforcements arrived on the unit, and a tactical invasion was pursued. Eventually, the patient was medicated, and over the period of the next few weeks, quieted down and became compliant. Roughly 180 days later, the patient was deemed competent to proceed in his drug possession case. The patient was indicted on felony charges, felony drug possession. He could not afford counsel, so a public defender was assigned. The defendant was found guilty by 12 of his peers. He was sentenced to time served plus probation. The probationary period mandated time in a mental health group home that doubled as a sober house. Upon his arrival, the patient complied with the government's demands of drug testing. The patient was also forced to get long-acting injections of antipsychotic medication every 21 days. The patient complied, and his religion of rebellion was eventually silenced, and he was successfully restrained and detained. There were rumors in the mental health sober house that this patient was problematic, engaging in devil worship, effectively worshipping Satan. Despite these rumors, the patient passed all of his drug screens and was medication compliant. He refused to get a job, but wrote a book about Satan, his perception of what Satan symbolized. Shockingly, he managed to obtain a publisher. The patient was known to root for the bad guy in films, and he had a strange musical interest. Nonetheless, there were no incidents at this sober house, and 1 year later, he was discharged from the program. Tragically, the patient was murdered by a group of religious zealots not long after. It appears like he was murdered for worshipping Satan. The assailants were hardcore Christians and would not allow a member of the community to worship Satan. Some people say he got what he deserved, but ironically, some disagree.